Nurses who are on probation are forced to stay on suspension longer than expected because of COVID-19, the virus that they could be fighting if they were working. RTV6 found dozens of nurses are waiting for the board to reinstate their licenses, but they're not meeting right now. Our Stephanie Wade finds out if anything can be done to get those nurses back to work.
And I've received several calls in my office saying, my license is on suspension and I'd really like to go back to work. I'd like to help during this time.
Lori Brown is both a nurse and attorney. She's fighting for nurses who are currently suspended or on probation to return and aid in the fight against this pandemic.
There are nurses right now who are ready, willing, and able to work. Their suspension time where they're eligible to petition the board to lift it is over, but they're not, since the board isn't meeting in person, they're not meeting to determine if these nurses' license can be lifted.
We spoke with one such nurse who was struggling with an alcohol addiction, substance abuse being the most common cause for suspension. She prefers we don't identify her.
Yeah, I'm coming up on 2 years sober. I've not had a drink in almost 2 years. And so I've put in the work on myself that I need to, and now I'm just ready to get back.
Hearings like hers have been pushed back because of COVID-19. She says she's a part of a support group and knows of at least 30 other nurses in the same situation.
And I apologize if I get emotional, but that's exactly how I feel. It's my passion to help people, and right now I see the need.
Hearing stories of the challenges her fellow nurses on the front lines are facing right now.
Where I validate these nurses' emotions, it's one of those things like I would give anything to be struggling with that right now.
The professional licensing agency tells RTV6 the Indiana State Board of Nursing is meeting via video conferencing, but their meeting agendas are limited compared to a routine meeting because of Governor Holcomb's executive order requesting all public meetings be limited to essential matters for the time being. We called into the governor's press conference today, but were unable to ask if he would consider amending that executive order to prioritize reinstating eligible nurses just wanting to help. Working for you, Stephanie Wade, RTV6.
If you are a nurse in this situation, reach out to us at workingforyou@rtv6.com. We can put you in touch with resources, and we'll let you know if there are any updates to this story.